Welcome back. I'm Dr. Oliveri, and this is the module most of you have been waiting for. Lower back pain is the #1 cause of disability worldwide. It affects 8 out of 10 people at some point in their lives, and it costs the healthcare system hundreds of billions of dollars every year. And yet the vast majority of lower back pain is completely preventable and reversible with the right exercises. Today, I'm going to give you the most evidence-based lower back pain protocol available, outside of a clinical setting. The foundation of this protocol is the work of Dr. Stuart McGill, Professor Emeritus of Spine Biomechanics at the University of Waterloo and the world's leading researcher on lower back pain. Dr. McGill spent decades studying exactly which movements and exercises protect the lumbar spine and which ones damage it. His research identified 3 core exercises, called the McGill Big 3, that activate the deep, stabilizing muscles of the lumbar spine. These exercises protect the spine without placing harmful compressive or shear stress on the discs. These 3 exercises are the backbone of this module. Exercise number 1 is the McGill curl up. Lie on your back. Bend one knee with that foot flat on the floor. Keep the other leg straight. Place both hands palms down under your lower back to maintain the natural lumbar curve. Do not flatten your back to the floor. This is critical. Now slowly lift only your head and shoulders off the floor, just a few inches. Your lower back should stay in contact with your hands throughout. Hold for 8 to 10 seconds while breathing normally. Lower slowly. Repeat 5 times. This exercise activates the rectus abdominis, your front core muscle, without the spinal flexion that makes traditional crunches so harmful. Exercise number 2 is the side bridge. Lie on your side with your elbow directly under your shoulder and your knees bent. Lift your hips off the floor until your body forms a straight line from your head to your knees. Do not let your hips sag or pike up. Hold for 8 to 10 seconds, lower slowly, repeat 5 times each side. The side bridge targets the quadratus lumborum, the deep muscle on the side of your lower back. That is one of the most important stabilizers. It also targets the obliques and the hip abductors. Weakness in these muscles is one of the primary causes of lower back instability. Exercise number 3 is the bird dog. Get on your hands and knees with your spine in a neutral position. Without rotating your hips or shifting your weight, slowly extend your right arm forward and your left leg backward until both are parallel to the floor. Hold for 8 to 10 seconds. Return slowly to the start position. Repeat on the other side. Do 5 repetitions each side. The bird dog trains the multifidus, the deepest layer of spinal muscles, along with the glutes and shoulder stabilizers. Research consistently shows that the multifidus atrophies rapidly after a lower back injury and almost never recovers on its own without targeted exercise. The bird dog is the most effective exercise to restore it. Beyond the McGill Big 3, we need to address 2 more critical contributors to lower back pain. The first is tight hip flexors. The hip flexors, primarily the psoas major and iliacus, attach directly to the lumbar vertebrae. When they are tight, they pull the lumbar spine into an exaggerated forward curve, compressing the posterior discs and facet joints. To stretch the hip flexors, kneel on your right knee with your left foot forward. Shift your hips forward until you feel a deep stretch in the front of your right hip. Keep your torso upright. Hold for 30 seconds. Repeat twice each side daily. The second contributor is weak glutes. The gluteus maximus is the largest and most powerful muscle in the body. It is designed to extend the hip and stabilize the pelvis. When the glutes are weak, which they almost always are in people who sit for long periods, the lower back muscles are forced to do the job the glutes should be doing. This overloads the lumbar spine and leads to chronic pain. The best exercise to reactivate weak glutes is the glute bridge. Lie on your back with your knees bent and feet flat on the floor, hip width apart. Drive your hips toward the ceiling by squeezing your glutes. Hold at the top for 2 seconds. Lower slowly. Repeat 15 times. You should feel this entirely in your glutes, not your lower back. If you feel it in your lower back, your glutes are not activating properly, and you need to focus on consciously squeezing them throughout. Your lower back protocol: McGill curl up, side bridge, bird dog, hip flexor stretch, and glute bridge. This protocol takes 15 minutes. Do it every single day. Within 2 weeks, you will feel a meaningful difference. Within 90 days, most people are completely pain-free. I will see you in Module 5. You are making incredible progress.